TAPS, as I mentioned earlier, is Twin Anemia Polycythemia Sequence. It's a condition that affects twins that share one placenta. So they're identical twins, and they're monochorionic, means sharing one placenta, as you can see here in this picture. In this picture, you can see one baby that looks really red, and the other one that looks really pale. And the one that's pale is anemic, which means you have low hemoglobin or low the red stuff in your blood. And the other one that's very red is polycythemic, means have too much hemoglobin or too much red stuff in your blood or thick blood. So this is a condition that we see it in twin pregnancies when they share one placenta. And the reason why they have this condition is this connection. So we know that twins that they have share one placenta, they have this tiny blood vessels connections. We call it anastomosis that connects the two circulation, as you can see here in this picture. And this tiny connection, tiny anastomosis, allows the red cells to go from one twin to the other twin. So one twin becomes anemic, so it doesn't have much, and the other one becomes polycythemic or have thick blood or having too much. And it's really important to differentiate it from the other famous problem that occur in this type of twin pregnancies, which is TTTS, or twin-to-twin transfusion syndrome. Most people would be familiar with TTTS. In TTTS is mainly the difference in the fluid, amount of fluid around each baby. So it's a discordance or difference in the fluid volume, while in TAPS, there's no difference in the volume or the amniotic fluid volume, but it's mainly difference in the hemoglobin or the red stuff in the blood. And the obvious question is that how common is this condition? And it's about affect about 3 to 5% of this type of twin pregnancies. But it is true that the majority of the TAPS cases, we see it after the treatment, after the laser treatment for twin-to-twin transfusion syndrome. So the pregnancy, monochorionic twins have TTTS. Usually the first line, or most cases, are offered laser surgery. We do the laser surgery, and afterwards we come across TAPS, because of that fact that during the laser surgery, we might have missed some of this very, very small, tiny connections or anastomosis, or maybe some of them after doing the laser, maybe they open up again. Some of the TAPS cases that we see, actually, they happen without TTTS. So a pregnancy that's been fine so far, hasn't been any concern, and then you have diagnosis of TAPS. And therefore, I think it's important that we are aware of it. It's important that we look for it, and so that we don't miss a diagnosis of TAPS.
I think that's a great explanation. And I think it is, there is a little bit of a myth that floats around that TAPS is a form of TTTS. And I think that's something that we probably need to start shifting our language around, is because both of them have different diagnostic criteria, different treatment options, and even different long-term outcomes. So I think that's a really important thing that we need to start looking at, shifting our language when we talk about it. And yeah, in particular, the importance of screening is there as well, because as you mentioned, we don't see fluid differences with cases of TAPS generally. It can happen, but not always. And the majority of the cases, we don't see them. And so the screening, and exactly how do we screen for TAPS, Asma?
That's a very good question. And again, I'm going to show you that 1 second. So in twin pregnancies that share one placenta, so we call it monochorionic twin pregnancies. If you see this flow chart, it summarizes what we've included in a number of guidelines. So the ISWG, which is the International Society of Ultrasound and Obstetrics and Gynecology, as well as FIGO, which is another organization, their guideline on how to manage or monitor twin pregnancies follows these twin charts. And you can see here, so in the red column, this is the stages in pregnancy, so 11 to 14 weeks, or 16 weeks, or 18 weeks. So, and on the right-hand side is what is the recommendation, what should we do in this ultrasound scan. So that's the frequency and timing of this when we organize the scans, and what should we do when we perform this ultrasound scan. And when we wrote this guideline, we did recommend that in all twin pregnancies that you share 1%, all monochorionic twin pregnancies, that we do an ultrasound scan from 16 weeks every 2 weeks until the end of the pregnancy. And in every scan, of course, we measure the babies, but we also look at the fluid because we're looking for TTS. But we also, from 20 weeks, that we look for the TAPS, or Twin Anemia Polycythemia Sequence, and we do that by looking at the blood flow in the baby's brain. So we use a technique called Doppler, and we look at the blood vessel in the baby's brain called MCA, or middle cerebral artery, and that we measure that in both babies, and to look for the diagnosis of TAPS. I think it's important to mention that this is not the case in all countries. It's certainly an issue which is being controversial. Should we monitor or screen for TAPS in all monochorionic twin pregnancies? So, for example, in the UK, where I practice, we have the NICE guideline, and the NICE guidelines on twin pregnancy, twin and multiple pregnancy, they don't recommend routine monitoring or screening for TAPS. And a number of reasons why that we can discuss later. But what they recommended, and I was a member of the guideline committee that did the update of the guideline that was published in 2019. They recommended that all twin pregnancies that had TTS and had laser surgery should have monitoring for TAPS after the laser surgery. That's very clear. Because if you remember, I mentioned that most of the cases of TAPS that we see are actually cases that had laser surgery for TTS. And they also recommend that we monitor for TAPS in all cases of monochorionic twin pregnancies that have any deviation from normal. So, for example, if there are difference in the size, so selective fetal constriction, one baby is a lot smaller than the other one, or if they have any abnormalities in the Doppler, the blood flow in the baby's blood vessels, or if there is any evidence of the compromise, so one or both babies, there's a problem there. So, for example, something called cardiomegaly, so the heart is quite big, for example, or hydrops when there's a collection of fluid in different parts of the body. Or even polyhydramnios, excessive fluid, not as part of TTS. So any deviation from normal, they recommend that we should monitor for TAPS, and we should monitor for the TAPS weekly. So every week, ultrasound scan every week from as early as 16 weeks. And in fact, in this pregnancy, we should get an advice from a fetal medicine specialist.